9 hidden causes of high blood pressure. You may have been cutting back on salt for years, watching your weight, taking your pills every morning like clockwork, and your blood pressure still refuses to come down. Here's why. In a large number of cases, the real cause was never on your plate at all. It was hiding somewhere your doctor rarely thinks to look, in a gland at the base of your neck, deep behind your kidneys, or inside a bottle of medication sitting quietly in your own bathroom cabinet. This video is for general educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Please speak with a qualified healthcare provider about any concerns regarding your own blood pressure or health. Before we go further, it helps to understand why this matters so much, especially at this stage of life. High blood pressure, also known as hypertension, is often called a silent condition because it can quietly damage the heart, the brain, and the kidneys for years before a person ever feels a symptom. And after 60, that damage tends to move faster than most people realize. Millions of adults are living with it right now, and a striking number of them have no idea because the standard checkups so often stop at lifestyle questions. Today we are going to walk through 9 causes that rarely make it into the average conversation about blood pressure, and stay with us until the end. Because one of them, sitting near the middle of this list, is something that happens every single night while you sleep, and it goes undiagnosed in millions of people for years, even those who see their doctor regularly. Number 1. Obstructive sleep apnea. Somewhere between snoring and simply feeling tired the next morning lies a condition that quietly raises blood pressure while a person sleeps. It's called obstructive sleep apnea, and it happens when the muscles at the back of the throat relax too much during sleep, causing the airway to narrow or briefly close. Each time this happens, the brain senses a drop in oxygen and triggers a stress response, releasing hormones that constrict blood vessels and push blood pressure upward. This can occur dozens of times an hour, all night long, without the sleeper ever waking up enough to remember it. Consider someone like Robert, a 61-year-old retired mechanic. Robert had been on 2 different blood pressure medications for years, yet his numbers stayed stubbornly high no matter what his doctor adjusted. His wife had mentioned his loud snoring more than once, but it seemed like a minor annoyance rather than a medical clue. It wasn't until a sleep study revealed that Robert was waking up, without knowing it, more than 30 times every hour that the missing piece became clear. Once he began using a small breathing device at night, his blood pressure readings gradually began to improve. What makes this cause so easy to miss is that many people with sleep apnea do not consider themselves poor sleepers. They may feel they sleep a full 8 hours, without realizing that the quality of that sleep is being repeatedly interrupted at a level too subtle to notice. There is rarely a moment of full awareness, just a pattern of restless mornings, occasional headaches upon waking, and a persistent sense of tiredness that coffee never quite seems to fix. Researchers have found that the relationship between sleep apnea and blood pressure appears to grow stronger as the breathing interruptions become more frequent, and the effect tends to be most pronounced overnight, which is one reason blood pressure in some people with this condition never truly dips during sleep the way it should. Under normal circumstances, blood pressure eases somewhat during deep rest, giving the heart and blood vessels a nightly period of recovery. When sleep is repeatedly interrupted by breathing pauses, that natural dip can disappear entirely, meaning the cardiovascular system may be working under elevated pressure around the clock rather than getting the break it needs. If blood pressure remains high despite a healthy diet, regular movement, and consistent medication, it may be worth discussing sleep quality with a healthcare professional, since this connection is often overlooked. A simple conversation about snoring, daytime sleepiness, or witnessed pauses in breathing during sleep can be the beginning of identifying a cause that no amount of dietary adjustment alone would ever resolve. Number 2. Primary aldosteronism. Deep inside the body, sitting just above each kidney, are 2 small glands called the adrenal glands. Among their many jobs is producing a hormone called aldosterone, which helps the body manage its balance of sodium and water. In a condition known as primary aldosteronism, one or both adrenal glands begin producing far more aldosterone than the body actually needs. The result is that the body retains too much sodium and fluid, and blood pressure climbs steadily higher, often without any of the usual warning signs a person might expect. This condition is thought to be present in a meaningful percentage of people whose blood pressure resists standard treatment, Yet it is diagnosed far less often than researchers believe it actually occurs. Part of the reason is that its symptoms can be so easy to explain away. Occasional muscle weakness, unusual tiredness, or mild cramping might simply be attributed to aging or overexertion, when in fact they may be linked to shifts in potassium levels caused by excess aldosterone. A blood test that measures aldosterone alongside another hormone called renin can help identify this condition. And when it is found, targeted treatment can sometimes bring blood pressure under control in a way that general medication alone never quite achieves. Treatment may involve a specific class of medication that blocks the effects of excess aldosterone, or in some cases, when only one adrenal gland is responsible, a surgical option may be discussed with a specialist. What makes this cause particularly worth highlighting is how differently it responds to treatment compared to typical high blood pressure. Standard blood pressure medications are often designed with the assumption that aldosterone levels are within a normal range. So when that assumption doesn't hold true, those medications may only partially help, leaving blood pressure stubbornly elevated no matter how many adjustments are made. For anyone whose blood pressure has remained difficult to manage despite trying several different medications, this may be a conversation worth having with a physician, since identifying this specific hormonal imbalance can sometimes change the entire treatment approach. Number 3 is thyroid dysfunction. The thyroid is a small, butterfly-shaped gland at the base of the neck, and it plays an outsized role in regulating the body's metabolism, heart rate, and blood vessel function. When this gland produces too much thyroid hormone, a condition called hyperthyroidism, the heart tends to beat faster and blood vessels can become less flexible, both of which can raise blood pressure, particularly the top number known as systolic pressure. On the opposite end, when the thyroid produces too little hormone, a condition called hypothyroidism, the body's blood vessels can stiffen over time, gradually pushing blood pressure upward as well. What makes thyroid-related blood pressure changes especially tricky is that the surrounding symptoms often look like everyday complaints. Fatigue, weight changes, feeling unusually warm or unusually cold, and shifts in mood can all be brushed aside as simply part of getting older or being busy. Someone might notice their heart racing occasionally or feel unusually anxious for no clear reason, and attribute it to work stress rather than considering a gland at the base of the neck as the source. Take the experience of Carol, a 59-year-old librarian who had been managing mildly elevated blood pressure for a couple of years. She also noticed she had been losing weight without trying, felt warmer than everyone around her even in cooler rooms, and found her hands trembling slightly when she tried to hold a cup of coffee still. It was actually her hairdresser who first commented on how noticeably thin her hair had become. That small observation led Carol to mention her symptoms to her doctor, and a blood test confirmed an overactive thyroid. Once her thyroid levels were brought back into balance with appropriate treatment, her blood pressure readings became noticeably easier to manage. A simple blood test measuring thyroid-stimulating hormone can offer meaningful insight, and for some people, addressing an underlying thyroid imbalance leads to noticeable improvements in blood pressure readings that medication alone had struggled to achieve. Because thyroid problems tend to develop gradually, periodic screening can be especially valuable for anyone with a family history of thyroid conditions or blood pressure that seems to shift without an obvious explanation. Number 4, renal artery stenosis. The kidneys do far more than filter waste from the blood. They also play a central role in regulating blood pressure by managing fluid balance and releasing hormones that influence how tightly blood vessels constrict. Renal artery stenosis occurs when the arteries supplying blood to one or both kidneys become narrowed, often due to a buildup of fatty deposits along the artery walls. When the kidneys sense reduced blood flow, they respond as though the entire body is low on fluid, releasing hormones that raise blood pressure throughout the whole circulatory system, not just locally. This cause is more commonly considered in people who develop sudden severe high blood pressure later in life, especially if it appears after age 55, or in those whose blood pressure suddenly becomes far more difficult to control than it once was. It's also sometimes suspected when a doctor notices that kidney function appears to worsen after starting a particular class of blood pressure medication, since certain medications behave differently when the arteries feeding the kidneys are already narrowed. Imaging tests that examine blood flow to the kidneys, such as an ultrasound that measures how quickly blood moves through the renal arteries, can help identify this narrowing without requiring anything invasive. Depending on the severity of the blockage and the overall health of the patient, treatment may involve medication to manage blood pressure and protect kidney function, a procedure to open the narrowed artery using a small balloon or stent, or a combination of both, guided by a specialist familiar with kidney and vascular health. In many cases, a careful, individualized approach tends to produce better outcomes than a one-size-fits-all solution, since the right treatment often depends on how significantly the artery has narrowed and how much it has already affected kidney function. Number 5. Certain over-the-counter medications. It's easy to assume that anything sold without a prescription must be entirely harmless when it comes to blood pressure, but that assumption doesn't always hold up. A wide range of common medications found in nearly every household medicine cabinet can quietly nudge blood pressure upward, especially when used regularly rather than occasionally. Non-steroidal anti-inflammatory drugs, often used for headaches, joint pain, or muscle soreness, can cause the body to retain sodium and fluid while also narrowing blood vessels slightly, both of which can raise blood pressure over time with frequent use. Decongestants found in many cold and allergy remedies work by constricting blood vessels to reduce nasal swelling, but that same vessel-constricting effect can extend throughout the body, temporarily raising blood pressure as well. Certain hormonal birth control formulations and some corticosteroid medications used for inflammation can also contribute to elevated readings in a subset of people who take them. Consider Linda, a 54-year-old teacher who took an over-the-counter pain reliever nearly every day for chronic back discomfort. Her blood pressure crept upward over several months, and neither Linda nor her doctor immediately connected the two. Once the pattern was recognized and her pain management approach was adjusted under medical guidance, her readings gradually settled back toward a healthier range. This doesn't mean every person needs to avoid these medications entirely, but it may be worth mentioning all regular medications and supplements, even the ones that seem minor, during any conversation about blood pressure. Number 6. Chronic stress and elevated cortisol. Everyone experiences stress from time to time, and the body is remarkably well designed to handle short bursts of it. When a stressful moment passes, hormone levels typically return to normal, and blood pressure settles back down along with them. The concern arises when stress becomes less like an occasional wave, and more like a constant undertow, present day after day, week after week, without meaningful relief. Under prolonged stress, the body continues releasing cortisol and adrenaline, hormones that were designed for short-term emergencies rather than sustained release. Over time, these hormones can keep blood vessels in a more constricted state and encourage the body to retain sodium, both of which contribute to persistently elevated blood pressure. Unlike a single stressful event, this kind of chronic activation doesn't always produce an obvious spike that a person can point to. Instead, it may show up gradually, almost invisibly, as blood pressure readings that stay a little higher than they used to be. This connection matters because it means that managing blood pressure isn't only about diet and medication. Addressing ongoing sources of stress, whether through better sleep, physical activity, social support, or professional counseling, may play a meaningful supporting role alongside other treatment approaches recommended by a healthcare provider. It's worth noting that the relationship between stress and blood pressure can also become somewhat circular. Living with a chronic health condition like high blood pressure can itself become a source of ongoing worry, which then contributes to the very hormonal patterns that make the condition harder to control. Breaking that cycle rarely happens overnight, but small, consistent changes, a short daily walk, a few minutes of quiet breathing before bed, or simply talking through persistent worries with someone trusted, can gradually shift the body's baseline stress response in a healthier direction. None of this replaces medical treatment, but it can meaningfully support it. Number 7. Hidden sodium in everyday foods. Most people picture the salt shaker on the dinner table when they think about sodium intake. But the truth is that the overwhelming majority of sodium in a typical modern diet doesn't come from that shaker at all. It comes from processed and packaged foods that don't necessarily taste salty. Bread, canned soups, deli meats, flavored rice mixes, and even certain breakfast cereals can carry a surprising amount of sodium, often without the flavor giving it away. The challenge is that sodium is used in food manufacturing for far more than taste. It helps preserve shelf life, improves texture, and enhances the perception of other flavors, which means it can be present in generous amounts even in foods that seem mild or savory rather than salty. A single serving of certain frozen meals or canned products can approach or exceed the daily recommended sodium intake all on its own, leaving very little room for anything else consumed throughout the day. Reading nutrition labels and paying attention to sodium content per serving, rather than relying on taste alone, can offer a clearer picture of actual intake. This matters because the tongue is a surprisingly unreliable guide when it comes to sodium. A sweet baked good or a bowl of cereal can carry a meaningful amount of sodium without tasting salty at all, since sugar and other flavors can mask the taste of sodium almost entirely, making it easy to underestimate just how much is actually being consumed across the course of a day. For many people working to manage their blood pressure, this hidden source of sodium turns out to be a far bigger factor than the shaker ever was. Simple habits such as comparing sodium content between similar products before choosing one, rinsing canned vegetables and beans before eating them, and preparing meals at home more often using fresh ingredients, can gradually reduce overall sodium intake without requiring dramatic or difficult changes to the foods someone genuinely enjoys. Number 8. Licorice root and certain herbal supplements. There's a common assumption that anything labeled natural or herbal must automatically be safe for blood pressure, but nature has produced its share of surprises. Licorice root, found in some herbal teas, candies, and dietary supplements, contains a compound that can cause the body to retain sodium and lose potassium, mimicking some of the same effects seen in conditions like primary aldosteronism. Consumed occasionally in small amounts, this effect tends to be minimal, but regular or heavy use has been associated with meaningful increases in blood pressure in some individuals. Licorice isn't the only herbal substance worth mentioning. Certain stimulant-containing supplements marketed for energy or weight management can also raise blood pressure, particularly when combined with caffeine or taken in higher than recommended doses. Because herbal and dietary supplements are regulated differently than prescription medications, their effects can vary widely and aren't always clearly labeled. Anyone managing blood pressure may benefit from mentioning all supplements, teas, and natural remedies they use regularly during medical appointments, since these products are easy to overlook but can play a surprisingly active role in overall cardiovascular health. There was the case of Harold, a 72-year-old retiree who developed a habit of drinking several cups of a licorice-flavored herbal tea each afternoon, believing it to be a purely soothing, harmless routine. When his blood pressure began rising over several months despite no other changes in his diet or activity level, it took a fairly detailed conversation with his doctor about everything he regularly consumed before the tea was identified as a likely contributor. Once he switched to a different variety without the licorice compound, his blood pressure gradually returned closer to its previous range. This doesn't mean herbal products should be avoided altogether, but it does suggest that natural and safe aren't always the same thing when it comes to cardiovascular health, and a little extra transparency with a healthcare provider can go a long way toward catching an easily reversible cause. Number 9. Chronic kidney disease. We've saved this one for last because it sits at a genuinely important intersection. Chronic kidney disease and high blood pressure share a relationship that runs in both directions. High blood pressure can gradually damage the delicate blood vessels within the kidneys, impairing their ability to filter waste properly, while declining kidney function can, in turn, make it harder for the body to regulate fluid balance and blood pressure, creating a cycle that can be difficult to interrupt without medical support. In the earliest stages, chronic kidney disease often produces few, if any, noticeable symptoms. A person might feel completely normal while their kidney function has already begun to decline, which is part of why routine blood and urine testing plays such an important role in catching this condition early, particularly for anyone who has lived with elevated blood pressure for an extended period. Two simple markers: a blood test that estimates how efficiently the kidneys are filtering waste, and a urine test that checks for small amounts of protein that shouldn't normally be there, can together offer an early window into kidney health long before more obvious symptoms would ever appear. Take the story of Margaret, a 68-year-old grandmother who had managed borderline high blood pressure for over a decade without major concern. During a routine annual check, a blood test revealed changes in her kidney function that had been developing quietly in the background. With that information, her care team was able to adjust her treatment plan specifically to help protect her remaining kidney function, while also working to bring her blood pressure into a healthier range. Margaret's story is a reminder that ongoing monitoring, even when someone feels perfectly fine, can reveal important information that guides better long-term care, and that catching a change early often opens up far more treatment options than waiting until symptoms finally appear. Bringing all of this together, it becomes clear that high blood pressure is rarely just about how much salt sits on a dinner plate or how many minutes were spent exercising this week. It can be woven into sleep quality, hormone balance, kidney health, everyday medications, chronic stress, and even herbal products that seem entirely harmless on the surface. Research suggests that a significant portion of people with treatment-resistant high blood pressure, readings that remain high despite being on 3 or more medications, may have one of these underlying and often overlooked causes contributing to the problem. A statistic worth remembering the next time a blood pressure reading simply refuses to budge. Understanding these 9 possibilities isn't meant to cause alarm. It's meant to offer a broader, more complete picture of what blood pressure regulation actually involves, and to encourage a more curious, thorough conversation with a healthcare provider whenever numbers don't seem to add up the way they should. It's also worth remembering that identifying one of these causes doesn't mean facing it alone. Each one, from a narrowed artery to an overactive gland to a nightly breathing interruption, has established paths for evaluation and management, and many people who once felt discouraged by stubborn blood pressure numbers have found real relief once the true underlying cause was finally brought into focus. If any of these 9 causes sounded familiar, whether it was the loud snoring mentioned by a partner, a medicine cabinet full of daily pain relievers, or blood pressure that has simply never responded the way it was expected to, that recognition alone can be the first step toward asking better questions at the next medical appointment. Sometimes the most important thing a person can do isn't found in a pill bottle or a diet plan at all. It's simply asking out loud to a trusted doctor, "What am I missing?" We would love to hear from you. Which of these 9 hidden causes surprised you the most? And is there one you think deserves a deeper conversation with your own doctor? Share your thoughts in the comments below. We read every one of them. If you found this video helpful, please consider sharing it with someone who might benefit from this information, and subscribe for more clear, careful explanations of the health topics that matter most. Thank you so much for watching, and we'll see you in the next video.